Welcome to the Kids Table, where the conversation is about fitness, but the maturity level is questionable.
The one and only Gunnar Peterson.
Then you've got Luke Milton, and then there's me.
It's weird if you do your own intro. Ladies and gentlemen, Jen Wiederstruck.
So pull up a chair as we talk fitness, the business of fitness, and give a voice to trainers everywhere.
It's informative, it's inspiring, it's where everybody wants to be. This is the Kids Table. Today's episode is powered by YETI and Train Heroic, the go-to platform for the go-to coaches and trainers.
Today's guest is Dr. Ethan Kellum, a board-certified orthopedic surgeon and regenerative medicine specialist who's changing the way we think about healing and recovery. He's the founder of Upper Room Orthopedics, where he specializes in cutting-edge, non-surgical treatments, including stem cell therapy and platelet-rich plasma, PRP, injections, offering patients real alternatives to surgery, especially for joint pain and sports injuries. Dr. Kellum's background combines elite orthopedic training with a deeply personal passion for faith-based wellness and long-term healing. He's worked with everyone from high-level athletes to everyday people looking to reclaim their mobility and quality of life without going under the knife. Whether you're curious about the future of stem cells in sports medicine, wondering if PRP is worth the hype, or just want to know what regenerative medicine actually means, this conversation has something for you. Please welcome Dr. Ethan Kellum to the Kids Table.
Hi, Dr. Kellum. Should we call you Dr. Ethan, Dr. Kellum?
Just call me Ethan.
Ethan, is that okay?
Yeah.
Amazing.
I want to put a title in front of it. I feel it feels naked, just Ethan. It feels like
I'm
doctor.
gonna call you Gunnar.
There's no title here.
Bring us into the tent. How did you guys meet? Because we're so grateful you're here, and I don't know origin story.
So we met through a good friend of my wife's, who is a friend of hers, who's a friend of our family, actually, Julie Bonanno.
Julie.
Yeah, lovely.
Yeah, real estate, and Dr. Kellum is stem cell wizard. Well, I read the intro for you, but let's hear it in your own words so people know. Because if I say it, it just sounds like I'm reading something off a card. But
yeah, so I'm a sports fellowship trained orthopedic surgeon. Did a sports medicine fellowship in Boston, and then when I left fellowship and got into practice, I was like just a regular orthopedic surgeon doing things in the community, and started kind of dabbling in what they call regenerative medicine, which is stem cells and growth factors and things, and just looking for a better way to treat people, because surgery wasn't always
and
the thing
pay off the med school loans.
Yeah, that too.
Okay, sure.
That too. I didn't know you yet, so I needed something, right? I learned about those things in fellowship. We took care of the Celtics, and because of that, those guys wanted those things, and someone probably in your history, Kobe Bryant, really put those things in the map. 2009, he went to Germany to have a product called Regenerative, which is like platelet-rich plasma, or PRP, that comes from your blood. I think at that time he had...
Isn't there a difference, or a fundamental difference with the Regenerative and the PRP, in that one of them causes inflammation and the other doesn't, and the other difference being that one of them is covered under insurance and the other is not?
Well, both of them probably are still not covered under insurance.
Okay.
Regenerative has this glass beads and heating up and all these things, activation, whereas PRP, you don't really do any of that. You let that activate in the body. And so fundamentally very similar.
Right.
But Kobe put that on the map 2009 with his patella tendon. And of course, you know how those things work. Mm-hmm. When someone gets, it's funny what happens in a locker room, right? It spreads like wildfire.
Yeah, that's like early influencer stuff.
Yeah,
without even trying to be.
Not even like just
any edge.
Yeah, but by the way,
edge to get ahead.
Yeah, but if I'm sitting in Chicago in a circle of my friends having beers, we're all pointing like pain points in our body. Like, I got my elbow, I got my back. You don't have to be Kobe to have stuff going on in your body and be like, hey, you got a guy for that? Who are you going to see to fix it?
Exactly, and that happens too. I mean, it happens in the sports world. It happens in just groups of friends and so on. And especially when things happen well and they recover. I say there's kind of four types of people I take care of. There are the professional athlete, or the athlete from high school to professional, senior saints, grandmas and grandpas that want to do things with their family and trips and travel and all that stuff. There's the weekend warrior. And then there's working stiffs like me that just want to feel better and do better. And so these little pains and those things, what you guys do and how, making sure that they can do what they enjoy doing and stay healthy and all those things. And part of that is saying, okay, how can we make this body feel better and do better? And these regenerative things allow that to happen.
What excited me about talking to you today is that most surgeons I meet really like doing surgery.
Yeah.
And as I looked through your Instagram and your website, you're actually paving a way around surgery.
Yes.
And that was really endearing to me. I was like, surgeons like to cut, and you're trying to keep people off the table.
Right.
And that excited me. And I think for me, I work with a lot of, it's general fitness. And I think there's a very big leap from, I have knee pain, I need surgery.
Correct.
And I think what would be exciting today is to talk through some of like what you're seeing and create some assurances for people. I pulled a couple quotes from you. One thing that I loved, you said, when you're still in pain, even after you rest, it's because the inactivity doesn't fix the root issue.
Right. Yeah.
I thought it was so great. You said rest is step one, not a plan. Right. And I think I have a lot of people saying lunges are hurting my knees, or I can't squat because of my knees, or I can't run anymore. And people are feeling whether they're that weekend warrior that can't do what they used to want to do, or maybe they've been a bit dormant in their activity and they're trying to restart. They're like, this is hurting, I better stop. And you're actually saying, oh no, there's a plan ahead of you, and I can create that plan for you. Yeah,
you don't want to ever stop moving, right? That's the worst thing to do. You're going to die if that's what happens. I mean, that's just the way it is. And so you got to figure out a way to continue that route. And rest starts there, but then there's other things to do. Nutrition is heavy in that. Regenerative things. There's also great supplements that can be super helpful. Just recently read a study, and we've done so many things with supplements, but gelatin, right? Yeah. Taking gelatin. There's a study looking at an NBA guy with patellar tendonitis. All they did was the things as far as certain, eccentric exercises, but took gelatin. And
just like a capsule?
I think it's a powder, but capsule, and healed it. I've never seen that before. Huh.
Can you talk us through why? Is that something to do with inflammation?
It's got to be connective tissue?
Yeah. So gelatin has collagen and other things in there, but nutritionally, making sure that your body has the building blocks to heal itself, and it wants to do that. Sometimes it's hard for it.
So even after it's broken down the gut, it can still go where it needs to go and do what it needs to do. It doesn't lose its potency?
It definitely can, yeah. Definitely can do that.
And is there a better way to do it? Is there a more significant absorption through orally, or is it,
Well, what other way do you want to go?
Hey now.
Well, we just talked about not going to surgery, so.
Oh, you meant like an injection. I was like, are we talking?
Could just throw in an IV, maybe a drip bag or something like that. But we.
Yeah, and certain things
There's a doctor on set, Jen. For God's sake.
So good. Good time here. Good time. I'm used to Gunnar, so this is.
Oh, yeah, no.
This is.
He's definitely the worst of us three, but I'm a close second.
Oh, no, yeah, you're cool.
Am I right?
No, you're good.
So there's definitely things that that you have to take orally, right?
Yeah.
And you can't necessarily do IV. And as we think about, there's so many things that go into that. And that's just one way as far as thinking about taking gelatin that can be super helpful. Like I recommend that now to everybody, anybody. You got any sort of musculoskeletal pain, I think you should have gelatin.
Is there a gelatin sitting in your Amazon cart now that we should know about? I can put it in the show notes.
Yeah, let me get my phone out right now.
I'll get the name and the link for you.
Will you?
But yes.
And a dosage too. We're going to need that because I'm the guy, and this is why I don't do drugs and cigarettes and coffee but I do caffeine. But I just know if I were coffee, really I'd be the guy ordering like 7 of them. So you got to give us a dosage on that because
in this particular product, it's a scoop a day. And but I'll get the link for you.
Oh, we'd love that.
And these are those nuggets that are life changing. So selfishly, I'm so grateful.
Such low hanging fruit.
Absolutely,
you know
absolutely.
What I mean?
It doesn't have to be as complicated. And I want everyone to understand that it doesn't have to be as complex or like in the weeds as you think. Sometimes it can be as simple as some nuggets, but consistency in the other things in life, right, Doc? Like you were saying, nutrition, movement, and all the things that add into a healthy lifestyle.
Yeah, that nutrition it's number one. I had a patient that lived in Minnesota part of the year, and then here in Nashville, the other part. And so I think she was there during the wintertime, and she was there during the summertime, was going to come here during the wintertime. And so I did a consult over the phone. She was having knee pain, and I told her about getting rid of the 7 big things, which are all the things that I enjoy: sugar, dairy, soy, corn, peanuts, and we've got 2 more that I'm blanking on right now, but getting those out of your nutrition. So she did that. By the time she got here to see me, she was like, my knees feel pretty good. And so
that was another quote that I was going to ask you about. She's like, you said a fuel either inflames or food fuels inflammation or healing.
Yes. Yeah.
I think it's such a, I am frustrated as a trainer because I think I'm trying to teach my people how just you change food, you unlock the life that you want. And in your case, you are giving them access to movement, living pain-free. Mm-hmm. Pain can be very, very tiring. As we all know that we've all had pain, we've all worked with stuff. And yet it's such a simple buy-in, and yet people don't do it.
Yeah.
And for you as an orthopedic surgeon, you're like, you said nutrition's number one.
Yeah. Nutrition is so big. I mean, even for myself, I've had those times where I don't do well, I don't eat well, all these things. And so a story, my now 20-year-old, he was probably 12 or 13 at the time. And he said, hey, let's play some basketball. And I never took it easy on him, ever. Mm-hmm. But we were moving and figuring some things out. And so life was super stressful. And, when you eat sushi from a gas station, bag deal, right? So you can imagine
I've been there.
How I was eating burgers, all these things. And, but I remember my knees just hurting so bad. And I played him in a game of basketball and he beat me. And he asked me, he's like, Dad, did you let me win? Hmm. And I was like, man, I don't give him anything. Like I did not let him win. Yeah. But I linked it back to what I was eating. When I cleaned that up, the knee pain went away. Perfectly fine. It's a real thing.
So first time he beat you legit was 20?
No, he was 12.
He was 12. Oh, okay.
12. But my knees were hurting.
Yeah.
I didn't tell him that.
Yeah.
But I was having a hard time. But it was all about
too bad. Your knees hurt too bad. That's on you.
Yeah, it's on me.
Right. It's not like
he beat me.
It's not like you pulled back because your knees were hurting. Yeah.
I just couldn't.
My son beat me at I want to say 16 or 17. He beat me like 10-9. We were at Duke on the practice courts, and we were just dicking around, and he beat me. And he goes, Dad, I beat you. And how was it? And I said, you barely got me. Somebody goes, Dad, I wasn't really trying. And I said, oh, really? And we turned it around, and we played again, and he beat me 10-1.
Oh, no.
I swear to God. He just went beep, and turned it up, and I thought...
Is this Henry?
It was Henry.
Yeah.
And I thought I was hanging with him. Yeah. Oh, he just embarrassed me. It was embarrassing.
My daughter's 9, so if she beats me anytime soon, we're in trouble. But Doc, I want to go back.
We're going to get you on the gelatin.
Yeah, exactly. Yeah, for sure. How quick did you go from being inflamed, in pain, whatever it is, to fixing your nutrition and then beating your son?
Yeah.
10-0.
So you can reliably, things change in 3 months if you do it well. Yeah. That's always the magic number for lots of things.
Layman question: if you double the dose, can you cut it to a month and a half?
Yeah, I don't know about that.
Doesn't work like that. Okay,
I don't know.
Can't blame me
for it. Great though.
Yeah.
And then I got some curiosity questions because I love this. I'm just generally a curious person, but especially with what you do. So you start out, you go in and you do your residency, and you do your placement in orthopedic surgery, which is very much like, as Jem was saying, it's a beast of a machine, right? Yes. There's a bunch of different pharmaceutical companies out there that finance a lot of this sort of surgeries, and you're usually forced to do replacements and whatever else. How did you go from that into really developing a curiosity or a passion around regenerative, and which is kind of at ends with what we're trying to do, right? Yeah. Hospitals are privatized. They're going to make money. How'd you?
So from when all of this started for me, as far as saying, hey, I want to go into medicine, there was just always this curiosity for me. And so I did a lot of research, and from looking at RSV, which is essentially a big time cold for kids, or looking at how radiologists read film, or looking at bone tumors and things like that. So there's always this curiosity that I had. And so then you get into your formal education and you're learning all these things. And yeah, it's crazy. All the things you're learning. It's like, you hear people talk about, it's like drinking from water. Yeah. It's just so much.
Oh, like a fire hose. Got it. Yeah.
Yeah. Just drinking like all this stuff from a fire hydrant. And, you just take it in and it's what you learn. And then, but that research part, that curiosity was always there. And so the basic science of things, how does this work? Why does this work? That was just always there for me. And I just tried to just stay curious. And when I would hear certain things and then certain things would present itself, I wasn't sold on the regenerative medicine part, although I learned it in fellowship. Like I said, they did PRP because the Celtics players wanted it. And so it wasn't anything that I necessarily thought I would do, but I just put it in the memory banks. And it wasn't until I got out of practice and I had a patient that was a runner, had really bad Achilles tendonitis, had been seen by 3 other orthopedic surgeons. I'm the new person in town. Oh, I heard you trained up here. You're big wig, blah, blah, blah. What can you do for me? I don't know what to do for you because you've had it all and you've had all the crazy things, nitric oxide and patches and all these things, increased blood flow and Graston, and he'd been in splints and boots and all this stuff and none of it worked. And runners, crazy people.
When can I get back on the road?
And high pain tolerances,
Distance runners, crazy people.
Yeah, in the head.
Agree.
By the way,
Strasbourg sock, triple down on the Cialis. I can make it by tomorrow.
Yeah.
Determination like no other.
Yeah, like no other. Yeah. And so I was walking out of his room and I said, well, there's this thing called PRP we could do for your Achilles tendonitis. Insurance doesn't cover it. And he was like, let's do it. Yeah. Did it, back to running marathons. And so,
wow.
And so it was one of the, and yeah, that's exactly what I said. Wow. And even 10 years into this, right?
You're literally just throwing a dart and
I got no idea.
Bullseye.
That's the art of medicine, right? I have no idea. But I don't think it's going to hurt you.
My father says that's why they call it practicing medicine. And
I used that the other day.
Oh, my father goes to that line all the time. And I go, Dad, it's funny the first 65 times, but he, to his point.
Yeah. That was it.
My question then, I guess, is for someone listening that's like, okay, Doc, I'm moving. I've taken these inflammatory foods out of my diet. Mm-hmm. I'm still having an issue. What would, based on what you've seen, what would make you want to steer someone to PRP versus stem cells? And I actually had to chat GPT stem cells, what they do, why they're so special. And I actually, when you mentioned the Kobe element, I don't know, is that an engineered stem cell? Is it bioidentical to him? Yeah. And I've had PRP on my face, but I think it'd be good to create a little bit more context.
Yeah.
Let's jump in your brain for a little while here.
So PRP comes from your blood. Blood is made up of 2 components, solids and then liquids. The liquids is called plasma. The solids are all the different cells. Red blood cells carry oxygen, white blood cells fight infection. And then you have platelets that we know as the clotting. They you cut yourself, platelets go there and cause things to quit bleeding and to mend that wound. Well, the reason that it mends the wound is because there's growth factors in there. And so because of those growth factors, that's what brings along healing. And it doesn't matter what the healing or where the healing is, your face, your tendon.
Yeah, I had a dog bite and a nurse basically just to walk, because I think it's helpful to get a visual. She drew my blood.
Yep.
She put it in a spinner for 30 minutes. Yeah. And then you saw a section of the tube that was red, and the section that was this gold. And
exactly.
And the gold is the PRP, the platelet-rich plasma. And she re-injected that into all the wounds on my face where the dog had bit me, and it regenerated where the skin, where the tooth had punctured. And so, but you could do that with someone's knee, right? Internally.
Exactly.
Is that what you're saying?
That's exactly what you do. You see those same growth factors that you would use in your face are the same ones that you use in the knee. And so when they were spinning that out, things spin out based on weight. So some of those cells they're heavier, right? And so that's where the red comes from. And then the cells that are lighter with the plasma and those platelets are in that kind of golden color.
I'm going to jump ahead, but I want you to hold that, to bookmark that. when you get into the Muse stem cells that you told me about, that I just remember staring at him going, what's he talking about?
Yeah.
We're in a new dimension now. If when you separate those platelets, do you have to like triple down on that to get to the Muse level, or is the Muse a different kind altogether?
That's a whole different kind.
So take us there too.
I'm super interested in the Muse stuff. It was new to me when I was researching it. I'm like, well, let's go.
And again, I mean, I've talked in the show, like a lot of the motivation for like my biohacks is vanity. Like I just didn't want to have scars on my face.
Right.
That's all I was doing, but I didn't realize it was being used to mend joints.
Yeah. So it's the same thing. And I have a UFC fighter friend that his wife is a nurse practitioner. So after every fight, to his scars, he gets PRP.
Does the PRP.
Wow.
Yeah.
So then what would make you choose PRP in a joint or a knee versus stem cell?
So PRP is kind of that first step, right?
Okay.
And something that's good and can be helpful. And if I do PRP in a joint, I like to do it like at least 3 times, because it's not as powerful as stem cells, but very powerful in its own right. Mm-hmm. And you've got all the growth factors that are there. When I think a lot about soft tissue, that's when I think about PRP. And also the aspect of PRP, as we get older, and when I say older, like above 40, PRP is not necessarily as potent as it could be. And also we know that if you use it in a joint alone, like I said, you probably should do it at least 3 times, but stem cells are definitely better long-term in a joint. But if you're doing soft tissue, PRP is great.
Is cartilage considered soft tissue?
Connective tissue.
It'd definitely be a hard tissue.
A hard tissue.
Yeah.
Okay, so if someone's listening saying, I'm bone on bone, I'm missing cartilage in my knee, PRP would be a waste of time for them.
Not 100% a waste of time, but in my book, it's not the best.
Okay.
And even
so, you step it up to stem cells, or do you go skip over that and go right to Muse?
No, you can step it up to stem cells. Okay. And sometimes combining those two, right? Combining stem cells with PRP, which is what I've done for a very long time, can be done. But definitely stem cells are
when you start with getting into the stem cells and the PRP. Do you just forget the gelatin entirely, or do you keep that on as an additive?
As far as like hyaluronic acid, injecting the knee. So there's sometimes when you combine that in there,
right,
you don't necessarily forget it. I don't use it a lot anymore. It's kind of like, the great thing about it is it doesn't hurt the joint using hyaluronic acid.
Do you mean injecting?
Yeah, injecting it. Yeah, it doesn't hurt the cartilage.
Scoop.
No. Oh. Are you talking about the injection or the...
First, I was talking about the gelatin capsules or the powder.
Oh, sorry.
And then he went to that, and I know what that is because I had clients who use that, so I thought...
I would use the powder or the
all
the
the time, no matter what?
All the time.
Yeah,
just
by the way,
as a catch-all.
Let's say he's working on this knee for me. Well, the other one I still want to take care of. My joint, I'm going to start taking gelatin tomorrow.
Yeah.
Listen, if you're still training with the plastic shaker bottle from 2012, it's time for you to upgrade. The YETI Rambler with the Chug Cap. It's built like a tank, keeps ice all day, and doesn't leak all over your gym bag. It's light, yet it's durable. I know wherever I go, it goes, whether it's holding my tequila, my water, my protein shake, or whatever else I decide to put in there. Grab one and stop making hydration harder than it needs to be. Go to YETI.com. Get in, get out, get going.
I'm 100% with you, and I think I want to lead into for everyone listening at home, Doc. So because so many people get different advice from you go to a surgeon, they go, okay, I've got to cut you open, I've got to do a replacement, a reconstruction, whatever else. At what point do you think it's advisable to get a second opinion, a third opinion, as far as necessary to unnecessary surgeries when it comes to general athletes? So people that are doing training or group fitness every day and they're experiencing some sort of degenerative knee or ankle or hip, compared to what can we fix naturally compared to when surgery necessary?
There's a lot of things that you can fix naturally. There's no guarantees with it. It doesn't work for everybody. But if you do it well enough and maybe enough, like you can get to a good place without having to do something surgical. These are the things that I take care of the most. It's also the thing that responds the best to what I do.
And how far back can you rewind the clock?
I think
you take somebody back I mean, obviously it depends on assuming that the rest of the condition is dialed.
Yeah, you can set things back 4 or 5 years with things. You can, like, by treating this, you can get 4 or 5 years. It depends on how active
So my dunking days are behind me.
I want to
clip that.
They might be.
Sorry, there's something. Yeah.
But then are you, in a way, basically, because here's my brain. Okay, so you buy Gunnar 5 years on his knee, right?
Yeah.
So then you need to do surgery anyways.
Takes me back to 70.
So now he's 72.
By the
way. So...
well, you could potentially repeat the process.
Okay. Aha. So
now we're talking.
That's what I was saying. Because like for me, I think, well, if I'm going to get surgery, don't I want to be my youngest, strongest self to make sure I'm ready to adapt to that procedure?
Yeah.
And you're saying, well, no, let's take you back 5 years and then run it back, like you said.
I'll be in diapers by Friday.
Benjamin Button.
but not the adult ones.
Yeah.
That was funny.
So good.
Does age play a...
Why do you point like
No, I actually didn't mean to, and as soon as I put my hand up, I wanted to pull it back.
He's so ageist.
But does age play a factor in your decision of what protocols to go through to help things?
I mean, it does to some degree. Everything kind of, what does this person look like? What do they do?
Yeah.
Even mindset, right, plays into that.
Such a good point.
And so that goes into patient selection. And, you guys, I mean, your best people are the people that are willing, right?
I agree with that
What a
statement more than you know. Yeah.
You're like, I'm a superstar when they're willing. And so that's the same thing with doing these things. And so all that plays into it. Also, it depends on like the joint, right? Some joints don't respond as well as others. Hips are notorious for not responding great. And so then it's like at the outset, it's like, okay, I probably need to treat this more than one time. And so you'll get much further down the road.
How much time in between treatments do you have to wait? I'm just rapid fire. I don't have a filter on today.
4 to 6 weeks. I like to, if I'm using, depending on what I'm using, if I'm using something from the patient, I might want to wait 6. There's other ways to get certain growth factors and things. And so that could decrease that time of how we do it. So yeah, it just depends on which product I'm using.
So let's go back to, if it's a soft tissue issue, right? Software, we're using PRP.
Yes, although I would love to use stem cells.
So let's talk about stem cells. So because I had to chat GPT it, I'm going to let you describe what that is, and then explain the difference between stem cells and then the Muse cells, which is where a lot of your research is taking you. Yeah.
So stem cells can be found in the body in different places. You can get them from bone marrow. Oh. You can get them from adipose, fat tissue.
None of that here, buddy.
That's right. That's right.
That's why he's always wearing a sweater. He's so cold.
Right.
It's just low body fat.
He's no fat at all.
Freezing all the time.
Yeah, chiseled by the hand of God. And umbilical cords, amniotic tissue, those things. And when we talk about those things, I always like to make the disclaimer that there's been a healthy born baby, there's been a healthy mom that had that baby, right? And it's just from the leftover amniotic or placental tissue that's going to be thrown away after birth. No aborted children involved in any of those things. That sort of
I have friends. Have you heard of this? I have friends. I won't name them because it's their business. They kept the placenta and the cord, and they gave them to this service, and they dried it out, put it in capsules, and they ate it.
Yeah, that's big in LA.
Yeah, maybe not common, but it happens. Like enough that I've heard.
Is there legitimate benefit to?
Yes.
Because you do see in nature, you see animals eat their own placentas. Yeah. Right.
Yeah. So it's growth factors, right? Those things can be helpful. Now, you got to get past the gut and all those things, but there's some of those things that do. So there's some legitimacy.
Pick some of that up at Trader Joe's on the way home.
Can you text Jess?
What's your best use for stem cells and?
That's for everything. Yeah. Anything and everything. Stem cells are they're kind of the flagship. That's where you put a stake in. Those guys are going to get you down the road the best.
So like Luke's got a hip issue in his labrum. He's been kind of going through it, getting better. Do you pull the stem cells from his body, or do you pull it from? Is there like a stockhold of stem cells?
Yeah, like a bank. Yeah.
A bank. Yeah.
Yeah. So you definitely can take them from him.
Is that gold standard?
For me, it is.
Okay.
But also you can get them what I call off the shelf. Too.
Okay.
I would like some of Tom Brady's, please.
Right. Yeah. Thomas, he's one of my favorite guys, and I'm sure he's done lots of stem cells. Yeah. Lots of them.
Let's hope so. But yeah, that would make you feel better.
Yeah. So you can take them from you. You can get them from other places, and they can be helpful.
Not to put you on the spot, have you used them?
Oh yeah, personally.
You have?
Yeah, and my children.
Do you do it to yourself, or do you have somebody else administer it?
Depends on where I'm trying to put it, right? But most of it's hard for me to start an IV on myself or things like that. So
you said and your children.
That makes me feel so much better when somebody has done what they're preaching, right?
Yeah.
And obviously that's not the case with all procedures, but I like hearing that. Like you're not somebody who goes, everybody should do this. Well, I haven't, but it makes me feel much better about it.
Yeah.
So you saw it valuable for your kids in what circumstances?
So they're athletes, and so I have a 18-year-old running back that he's had some injuries over time, and so he's been.
You have an 18-year-old kid who's a running back. Yeah. I think we don't classify them by their position.
Right.
Sorry, Doc.
We've got PTSD from the last
this
episode.
This is my running back.
One word.
This is my linebacker.
So he's been treated several times. My sophomore has been.
But can you describe what treatment, what you saw?
Yeah.
What made you say, as a parent and as a physician, you're like, this is a yes?
Yes. So it's like, hey, we've got this little tendonitis, or we've got this hamstring strain, or we've got a concussion.
Oh, wow.
We're my goal with, and my athletes in general they're not my favorite, but they're my special people, right? Mm-hmm. And you guys, once again, know completely about this. You have to talk to them in a certain way, and you have to get them to understand, because their whole goal is to get back and to get back better, right? And so I apply that to my children and saying, okay, hey, what do I need to do to help you get back to where you can be functional in that field and do the things that you enjoy and love? And so, treating them with those things have been super helpful.
Did you not see them recovery fast enough, or was it more like, I know this is going to help you, and so we're doing it?
Yeah. So it's my experience of treating all those professional athletes over the last that I go, why I would do that for them. Why wouldn't I do that for my kid?
Yeah.
It's so funny watching the three of us like, tell me more. And we're usually always
battered
talking
right now.
No, I know. And I apologize, but I don't really.
No,
I'm loving
so
it. But you just brought up concussion. All three of us go, whoa.
Yeah.
Can you talk us all through, because this is a big topic at the moment, right? We're talking about CTE. We're talking about like concussion. We're talking about contact sports.
How many have you had, Luke?
A lot.
Yeah.
I'm not making light of that. I played rugby professionally in Australia. I had a lot of concussions. One of my only fears was the potential for CTE. Now, I did some of the precursors. I don't have any of the signs that would, I naturally have this low of an IQ. But it is one of those things that it is a fear to a lot of parents who are considering or contemplating putting their children into contact sport. And version of contact sport could be heading a soccer ball these days, right?
Right.
Can you talk to us a little bit more around what, number one, was the instigator to make you use stem cells for a concussion therapy? And then, if you wouldn't mind, going into more what the results of that was.
Yeah. So, when you look at this, or look at the problem, right, of essentially your neurons are just scrambled. They're trying to figure out what they need to do. And the basis of just about any disease, whether it's tendonitis or it's a concussion, has to do with inflammation, and things are not working well. And stem cells have the ability to say, I'm going to help you do what you need to do. And so as I talk about that, it's in the literature. It's right there in plain sight. All the research talks about stem cells, talks about concussion, and how that can be super helpful. And so once again, experiencing concussion, but also when your child experiences a concussion and you're like, what am I going to do for this?
Where do you inject
all the stops?
The stem cells.
So ideally, if you could put it in the brain, right? That's ideally, but I'm not trained to do that.
Yeah.
So two great places that are super easy to do intravenously.
Okay.
You can do that. And then also intranasally.
Because they know to go to the traumatized area.
Yeah.
Okay.
Most of the time. Right. And so do it IV can be very helpful to do that. And then also intranasally, right? So there's the little cribriform plexus that lives up there in your nose, and you get a direct shot to your brain. And so that can be, and so doing intranasal.
That's fascinating.
Can be good.
Yeah.
Fascinating.
Wow.
So this was the ChatGPT response on what are stem cells, and I want to ask this read so it helps people get on the same page, and then also ask a question. So it says the two key things that stem cells do is one is self-renewal, meaning they can divide and make more stem cells. So there's like a multiplier effect.
They can do that. Now, when you put them in the body, the mesenchymal or medicinal or the signaling cells that we call them at sometimes, they're not going to sometimes make something new, but they're going to handle the inflammation that's there.
Okay.
And that's how they mainly work.
So that was the second bullet point. It was differentiation. They can develop into different types of specialized cells, meaning muscle, nerve, blood, and so on, to take on the action needed. Right.
And that's more of when we talk about the Muse cells, that's more that those cells definitely do that. But stem cells really work to decrease the inflammation, or they kind of work like a hormone on a cell, right? And cause that cell to do what it's supposed to do. And it definitely can reset the cell, making it act younger, making the mitochondria function better, all those things.
So bringing up all that sort of stuff starts to go into the longevity play, into the anti-aging play. So as we start to talk about that, and for everyone listening to this, what are some practical ways people can do some sort of a stem cell advancement, or like without having to mortgage a house or sell an organ to get it?
To do that, yeah. I mean, once again, you go back to nutrition, right? And eating well. Fasting for 3 to 5 days will raise the number of stem cells in your body.
And when you fast,
does that touch on like autophagy? But I thought that was more like
autophagy plays into that.
But I thought that happened at the 17-hour mark.
Yeah, you definitely, like I said, you probably want to do 3 to 5 days to really get to that point of making more.
It's a big difference between 17 hours and 3 to 5 days.
The process. Sorry, I'm not the doctor, but the process starts at 17 hours, right? Or it gets further at 36 is like the key to when they start.
I would say that sweet spot is definitely when you get to 36. That's when you start getting autophagy, mitophagy, all of those things.
But doesn't weight training, strength training also create autophagy in your body?
Correct.
So does that also influence our stem cell regeneration?
It will, as well too.
And can we be clear, because I've been posted this question a million times. Can we define what a fast is?
Yeah, so I like, when I define a fast, it's water only for those set amount of hours. And I said 36 is a really good. If you can do 36, like you got a good start. Yeah. If you can do longer, that's really good. And there's no doubt that fewer calories can be helpful too in general. But like for me, no food, just water. You can probably do black coffee, tea.
Is this why so many cancer patients are on that 17-hour fast window?
Yeah,
that's gotta be it.
Yeah, it's helpful for those things. Because now you're trying to. Once again, the body wants to do all these things, and it can. You just got to help it. And when you have, excess food around, it's just bad for the body overall over time.
I mean, this is fascinating. I could literally just sit here, and I'm so sorry for all of the questions, but I think this is so powerful, and goes into people's everyday lives as far as not only just like from function and performance and aging, like not even talking about sports and athletes.
Yeah, I don't even have an injury. I feel like I should get a bag of STEMIs, right? Like what's
STEMIs? I love that. I'm going to challenge you.
Should.
I think we're all injured. I think we're all injured if we're not our optimal selves. And I think that what we're starting to talk about now,
what I'm saying,
you might be the exception to that. You know, and I'm not being a smart ass.
You
may be an exception to that because I know you've just done a really, very demanding competition. You perform super well.
Yeah.
But I think that the answer to a healthy lifestyle and an optimal lifestyle is much closer than people think. I'm not saying it's easy, but I think it is a little bit more simple than people think. And the big things for people to remember are these nutrition plans, making sure that we're doing the right thing. When we're talking about fasting, because that's getting a lot of clickbait at the moment, right? And so we'll start looking at that 3 to 5 day. That's a recommendation. Water, or as close to just water as possible. How many times a year would you do that in a healthy?
Yeah, so there's some very interesting research that talks about if you did that once a quarter.
Interesting. Yep.
That's what I saw.
3 to 5 days.
I may have only taken like headline in 2 paragraphs, but I saw the same thing because they were talking about somebody famous had done it for 5 days, and the argument was, who has time to do that? Nobody lives that life. That guy's wealthy. And you just thought, all I thought was, skip eating Friday, take a half day at work.
Correct.
Don't eat over the weekend.
Yep.
Roll in Monday. You're a better person. But you
100%.
won't do it. That's really what it comes
discipline.
down to. And it's discipline. And I'm not bagging on, like, you have your reasons for not doing it, but when you're talking to me about chronic pain or about obesity or at least on the cusp of it, but you won't do that if the doctor, forget what the trainer's saying, but the doctor is saying this will help a lot of your ills. This will push you in the direction of better health. It's almost like the Candyland thing where you skip up a big thing, but you won't do that. To me, not to be harsh, conversation's over. I'm not going to keep walking you through all these baby steps when I'm telling you, here's a way to make a quantum leap, but you won't do it.
I'll tell you, I do a fast every 6 months. And
For how long?
So it's not a water fast. It's a brand called Prolon. It's the longevity Dr. Longo.
Yep, out of Southern California.
Yep, some cool research. To me, I needed a kiddie stool into the water fast, and I've done that a few times. And do you get hungry? Yeah. Do you get a little insomnia by day 3? For sure. But I've never been more productive, more clear. You really learn about yourself. I learned about how much I'm using food to procrastinate, to distract myself, to cope with something, eating out of boredom. And so it's a really reflective period. So yes, it takes discipline. It's helpful because in that specific fast, you get like the soups and the bars. And it's a little bit more manageable.
Exactly.
But I think it's a very, very hard thing to do.
My mom used to do it every couple of years. She would go to a place in, I think it was Germany or Austria, called the Buchinger Clinic. I don't know if they're still around. And it was like they had a tablespoon of, I think the morning was coffee maybe, and then they had like a tablespoon of honey at lunch, and then they had a clear consomme at dinner, if I remember the protocols. And she came back, obviously your weight drops, crazy weight, but she came back always, and like you said, her skin enlightened, and it was clear. It was cool that she would do that.
Yeah, and all the research that I talked about was from Dr. Longo.
Oh yeah,
and so when they started that initially, it was for diabetes.
Yes.
Yeah. And I don't say the word cure a lot of times, but if someone did that for about 4 to 6 months, no more diabetes. Type 2. It goes away.
So Doc,
and wait. But if they return to regular eating protocols, does the diabetes then return, or have you reversed it in a way that it's not coming back?
You can reverse that to where, as long as they don't go back to the same eating habits.
So circle back to what I said, but they're not doing it.
Yeah.
They're not going to do it. They'll go, I can take a medicine for it. I'm fine.
Yeah. Yeah, they would rather do that.
Yes.
Well, it goes back to the way that society's been educated, though, right? And kind of how we started this, which is why I've got so much respect for people out there actually, forging their own way. Because the easy way is to take the insulin or, do whatever we've got to do, because that's how we've been taught to think, in my opinion. I'm certainly not putting words in anyone else's mouth, but there are actually natural cures out there and natural things that are going to improve it. But I want to go back to what Jen was saying, because I'm fascinated about this fasting. I think so many people are fascinated about this at the moment. Would you get similar results concerned with a pure water fast with maybe some black coffee in the morning compared to what Jen was talking about with restricted calories? Or
yeah, I think you get a very similar result. In that particular program allows you to have something which is good. I think you're going to stay under like 750 calories in a day.
Yeah, about.
And for those 5 days. And so you're able to have something. And like I said, you can, but the results are the same. Like I said, when people do that, it will reverse diabetes.
That's wild.
If you're a trainer looking to level up, grow your business, and actually connect with your clients, Train Heroic is the game changer that you need. I used it for years, and it was the first tech my clients actually enjoyed using. They showed up, logged the work, and I could coach them through every rep. Trusted by top coaches since 2012, plans start at just $10 a month. And you get your first 14 days for free. So head to trainheroic.com/the kids table to start your free trial now.
A lot of people are really doing what they feel is the best that they can.
Yeah.
I know a lot of single parents with multiple kids, with multiple jobs. And at the end of the day, all they have left is food.
Yeah.
That becomes like, they're not going out drinking, they're not doing drugs, you know what I mean? Like they are regimented, they're hard workers, and food becomes a place of comfort. And what I'm defending is, I'm trying to give your life back. Surviving is getting out of type 2 diabetes, right? But for them, they're just trying to survive a day.
But what if you're telling them that the food they're eating is worse than drinking or worse than drugs? And I'm not saying it is, but I'm saying if you position it that way,
no, I agree,
to me,
but
that's
they don't think they
sell.
can make it through a day without that food.
But you're
support.
giving them substitutes. You're not.
They're
like
choosing a substitute. I agree, but I'm saying the immediate threat is I got to survive today. And that puts off what the real outcome, which is their life, which is the swap for a better outcome and horizon, because they're just trying to do right now. And I think there's an immediacy and a grace that's not being given to that population. There's a lot of people that are just lazy and eating shit, and I know that's there too. But I just want to say, like, food becomes this guardian. Food becomes this.
I'm not questioning you.
Right.
I'm not disagreeing with you at all.
No,
My fight's not with general pop.
Right.
My fight's with the information that people that is getting to general pop is getting, and that's why I've got so much respect for what you're doing, Doc. And I'm not just saying that because you're here. It's a real point of passion for me, because I think there's so much unnecessary nonsense out there that we've just been taught, and it's the way that the education system has developed with doctors and with unnecessary surgeries. And that's not to say that there is not a place for traditional orthopedic surgeries, for traditional surgeries in a lot of different ways. I'm certainly not saying that, but there are so many fixes that some of the disruptors have really identified years ago. We start talking about potentially reversing the signs of early onset dementia and Alzheimer's. We start thinking about, we have so many powerful tools in our toolbox there that aren't necessarily being used because it's being thrown into a box of being a charlatan or, doing things like that, when that's actually not the case. It's just there's not as much profit off the back end of doing some of these things. And I'm also not that guy. I want to be very clear that I don't think the world's against us. There's a million conspiracies out there. But I do think that we have some sort of moral obligation to get objective information out to the masses.
Yeah, for sure. I mean, we've talked about nutrition. We haven't talked about sleep, right? There's just so many things that can be done, and there's a lot of things that are out there, but if they're not kind of mainstream, then they get tossed to the side, or we get an education on the TV about this drug and that drug, and
when you have someone who's a candidate for the stem cells, and you're going forward with the stem cells with that person, how much do you pump the brakes or hit the gas when it comes to all the other factors, sleep, nutrition, that, or you don't just go, well, since you're going that route, don't worry about the rest?
Yeah. So as I've gone along in this, and that's a great question, and not only a great question, but a great challenge, because when you think about it as a program, is what I would call it, but it's like, okay, there are these 6 things that we've got to do. I know we're taking care of your knee pain, but if we can do these 6 things, then you're going to get a much better outcome from what we're doing versus if we just do this one thing. And so that's really, it's really important, right? And sometimes it's also hard to get people to buy in completely to that, because there's still that aspect of us. We all are this way. We're just like, we want to do this now, and we want this one thing, and I don't really care about the other stuff. Let's do this, and let's see where I get.
I mean, I know people that have done lap band surgery and they're still eating drive-through or fast food. You're like, come on.
Yeah.
What, we just did this thing.
I know people who've done the whole where they slice the arms open and they slice the body, and then they not just lipo, but it's the bigger deal of that, and then they sew them back up, and then the people go back to the other eating habits. You're just like, now you're just trying to put the same amount of shit in a smaller bag, and it's just gonna, at some point, it just looks uncomfortable.
And it is. I mean, I've worked with a lot of people. They come to me after they've done the lap band and they've liposuctioned, and then they take off the skin and then they gain it all back.
That's what it was. That's just the taking off the skin.
Yeah. Because you have to. It's up here. But that's what's so interesting. It's like, because don't you want to make the most of this stem cell journey? Right. Like,
we've taken this time, effort, expense.
Money. Yes.
I think, like I said, for me, that's where I'm living now, and trying to create that for people.
It's so funny, we're doing the same thing.
Yeah, like here are these 6 things that I know we're dealing with your knee pain, but if you do these 6 things, nutrition, supplementation, even peptide therapy, what we do as far as stem cells and those things, and then having good thoughts, right? That plays into
people.
That's one of the things.
We laugh. I know you're not laughing like that, but there are other people that go, "Oh my God, don't give me the thought thing." No, you don't understand. It's an information diet, right? What you put in here and here has an effect. It's the same as what you put in here. You got to be careful how much you take in, the quality of what you take in, and that's. I could make a joke, but I won't. But you know what I'm saying? Like, you got to monitor that. The amount, the time that you take it in, the severity of it, the intensity of it. You can only see so many things before it's like it's polluting you. Yeah,
one of the things I was never taught in my formal training was that, and there's a book called this, but the body keeps the score.
Yes.
It's great. It's a Danish author.
Oh, yeah.
Great.
I read that.
Body keeps the score.
What's your theory?
I read that last year.
What's your theory? Why are we not learning this? Or now that you have the knowledge, why is it not being deployed as much as it should be?
This will sound super woo-woo, but I believe it to be true. I mean, we are energy. That's what we are. Yeah. And I believe we're energy with the soul and all those things. But there's good and there's bad energy, right? I met Gunnar, good energy. Really? I met you guys. And you feel that, and you understand. You just, like, people have done it too many times. People at concentration camps. The mind is so wild. And if you have it to where it needs to be, or if you think properly, but that all goes back to this. To the energy of the body. And so the body keeps the score about what the mind thinks. If you think bad things are going to happen.
Well, that's the trends of the blue zones, right? Like human connection, simple life, eating well. It's not woo-woo, right? It's been proven. Movement. It's been proven 1,000,000 times over. I'm grateful that it's starting to get at least some kind of mainstream media now, because there are a lot of guys around, and not to just promote anyone, I've no interest in anything outside of it, but like Function Health now with Dr. Mark Hyman, and I know like Brecker's getting a lot of notoriety, and Huberman, and there's a bunch of people out there that are getting their message out there, and they all seem to share similar things around nutrition and around being able to potentially fix some ailments that we didn't think we could fix without medications before. Right. This is by no means medical advice from me, trust me, but
No, I mean, like I said, even in my own life, like how I think and growing in that way and understanding. I mean, if you have kindness, you're going to get kindness.
I could not agree more.
It's that law is just, it is, but if you put out, it's just, I mean, it's amazing what happens. So if you believe in abundance, that's what happens.
It is.
Yeah.
Fully. Now, what if I believe in Muse stem cells? I want to hear about this. I want people to hear about this.
Yeah, I'm so
when
curious.
You told me this at the house, I was like, I was just staring, thinking, I already have 100 uses for it.
Okay.
Hit me.
I'm in.
So Muse are is a very interesting subtype of what we call mesenchymal stem cells, or stem cells. So you can kind of think about Muse cells like you have the Navy, but then you have the Marines, right? And they're not the same, although they're together. And so Muse cells were discovered around 2009 by Professor Dezawa out in Japan. And she has a very interesting story how she found them. She talks about going to a drink party. She was going, and she essentially made a mistake in her laboratory experiment.
Because she was cocktailing?
Because she was going to. So she was in a rush. She was going to, like I said, she calls it, I was going to a drink party. And so she left a material in the stem cells too long. Well, the majority, when she came back, the majority of the cells were dead, except for this one particular cell type. And so she realized her mistake. She looked at them. And then she started testing them, and she realized that they had different properties. And so she studied them from there, and they are this very hardy, resistant type of cell. That's a subpopulation. You can grow them out, and then in Japan, because the laws are different here than the States, they were able to use these cells in human trials. And they showed some fascinating results. People that have heart attacks, and so when you have a heart attack, part of the muscle dies. And because part of the muscle dies, then you don't have as much ejection fracture. So when you treat someone with Muse stem cells that has a heart attack and compare that to someone that you didn't treat, their muscle doesn't die as much, right? So there's less percentage of dead muscle. And now because of that, their ejection fracture is greater. So it lessens the blow of a heart attack.
Ejection fracture, would that be how much blood you're moving through the heart?
Yeah, you're
beat?
that you're able to pump out. Okay. So imagine if you're pumping 1 liter versus 4. I mean, I'll take 4.
The hour?
Yeah, or
So we're talking about the muscle of the heart. Are we saying that we can regenerate any killed muscle of the heart, or just the efficiency of it?
Well, both.
Both.
Wow.
Yeah, both. And the Muse cells are able to do that. When we spoke earlier just about stem cells in general, sometimes stem cells don't necessarily incorporate into tissue, right? They'll have an effect on tissue, but they don't necessarily incorporate into tissue. Whereas these Muse cells,
is that considered a fail? Like if you undergo the procedure and they don't incorporate into, did that fail and they come back, or did that fail and they're no longer a candidate?
No, not as far as like
the procedure itself.
The procedure with regular stem cells?
Yes.
So not necessarily a fail, because stem cells are going to have an effect on the cells. They're going to make things better. They're just not like the Muse cells in the way that Muse cells actually incorporate into the tissue. So now they've actually become the heart tissue or the vessels or skin or brain or things like that. They have the ability to go in there and say, oh, that's damaged. I'm going to eat that cell that's damaged, and now I'll become that cell. Very different.
Is there a halo, like a timing halo? It's like, I had a heart attack this morning. I get the injection tonight. Am I okay still? Or are we still learning that?
It definitely, the sooner the better, for sure. But some of the research that showed, especially like with stroke, it was 2 or 3 weeks later, and people still have an improvement from having those things injected.
What about something like Parkinson's disease?
There's actually, I think there's a human study with Muse cells and Parkinson's.
That was my next question.
And it's either Parkinson's or Alzheimer's that's there. But you definitely see that the symptoms, they lessen over time.
Well, I think about muscle wasting diseases. I think about when anything neurological, MS, where you start to get that myelin sheath is breaking down. Are we able to do a stem cell IV? Because I don't know where you would inject it into your CNS, right?
Yeah, you would definitely do those things IV. And that's also one of the things that when you talk about Muse cells versus other, is that, hey, we believe wholeheartedly that those cells get by that blood-brain barrier into the CNS and those things. And not only that, they actually, they hone to the spot by way of a signal. So all the tissues that's damaged are saying, hey, I'm damaged over here and I need help. And they're putting out this thing called S1P, sphingosine 1-phosphate. And the MuseCell actually will find that and then.
And regular stem cells do not.
They don't.
Same application. You have the Muse the same way intravenously, or
you can do intravenously. You can do locally.
Would you ever do it the way they do like an epidural cortisone, where you do it in the small of the back, or is that too close to the kitchen? I
mean, you could definitely consider doing those things, yes, you could do that for sure. One of the things one thing to say about MuseCell is we can't necessarily, if we do MuseCells for you, we go to Mexico and do those things. There's some states that are coming online with that, but we
So do you have them at your clinic yet?
Well, I can do them out of the country super easy.
Oh, yeah. Fascinating.
Yeah, super easy. I've got clinics in Mexico that I go and do those things at and other things.
I think I just saw somebody went to Dubai to do it.
Yep.
Yeah.
Dubai has been doing it a lot over the last few months.
Is this an FDA holdup?
This is, yes, would be an FDA holdup. And, we definitely understand those things. FDA is there to protect us and make sure that that we do things well and we're protecting.
And that there's a protocol on certain procedures observed throughout from getting it to implementation to follow up, right? You don't want to drop the ball anywhere.
There's certain states that are coming online too, so there's some opportunity.
So let's play the game again. I don't feel compromised or injured at this point, but I'm like, you know what? I want to do a bag of Muse cells. I want them to go find the signaling tissue or whatever, just for optimizing, biohacking my own health.
Yep.
I go to Mexico. Do I do a bag a year? What's protocol?
I think a bag a year, a bag every couple of years. I mean, some people some people would say every 6 months. I think definitely a year works well.
Are you allowed to discuss the price tag on that?
We definitely can discuss.
Because I'm assuming you don't take Blue Cross Blue Shield.
We don't take Blue Cross Blue Shield for sure. There's definitely more than your procedure that you would get here in the States.
He'll tell us that after the show.
And prevention is better than cure. Is it something like, to Jen's point, is it best to do it when
it's definitely in the tens of thousands?
Yeah, but I'd rather pay $10,000 now than $50,000 later for a knee replacement or more. You know what I mean?
So here's a question. They talk about certain people shouldn't take certain things before the age of 30. Like they say, you're working optimally up to then, and any doc who's pitching you. I mean, I used to hear it about the steroids and growth hormone, like these young people that wanted it. They said any doc giving you that, it's irresponsible, because at your age, at your level, you're not optimizing your body. You're not doing the best you can to let it do the best for you. So you got to wait till that. Is stem cells? Is there like a? I mean, you said you've done it on your kids, but I'm saying that was for the tendonitis you said, or
for injuries.
Right. So if there's somebody who's feeling, like Jen said, she's feeling great, doesn't feel like she needs it, but as a preventative, can you do it at age X versus Y, or can you do it any time as a preventative? Yeah,
no, I think definitely doing it, if you wanted to do it at 30, I think that's a great age to do it. Preventative, even though you feel good and look good and all those things, I think that it helps prolong that need for anything.
So when Jen turns 30, she could do it?
She can do it.
Okay, great.
I'm 43.
We know.
Yeah, I'm letting him know.
No, I could sit here for
any other. I mean,
this is so great.
Is there anything else?
Yeah, I know.
There's so much.
I know.
I feel like I need stem cell for my brain right now.
I honestly, I want to test it on you. I want to see, you're already a machine to me. So what would that do? How would you feel? How does it affect every other area of your life? You're very expressive about really treating whole body health.
Yeah. I do have you answer that, and then I have one more for you. So
yeah, definitely. I mean, the whole thing is about inflammation, right? Harvard put out a study and they call it inflammaging. Yeah. And that's really what causes the aging part. And so stem cells just help to, hey, we're going to improve this area, we're going to help these cells do better. And like I said, when you put it all together, right? Yeah. When you're doing nutrition and you're doing sleep and your peptides and lasers and all that stuff, in working out, things.
What peptides do you recommend?
That was my next question.
Oh,
my question was literally going to be, you hear about using, forget testable, but more like BPC 157 is the one that it gets so much, it gets in so many conversations. I would say, the way people speak about it is literally like someone came down from the mountaintop and is presenting
I side injected into my knee after my dislocation.
Okay, so if you're doing that, are peptides then superfluous? Are Muse then superfluous to peptides, or
I think
throw it all out there?
I think doing all of it is very helpful.
Yeah.
And
kitchen sink.
Yeah, and when you think about, especially just the body in general, collagen, what it's made of, a BPC 157 is really good combined with like a TB 500.
Wolverine combo.
Yeah, even using something like
they call it. That's what I was doing.
Yeah.
I know, but I just love that you were the one that did it.
Yeah.
I was sitting here thinking that, and then I was
that
like,
was my Wolverine class.
And then even adding something like a GHKCU to that. So that's really good just for like, as you think about what the body is made of and helping with healing and gut.
Text
and all
myself
those
that one. GHKCU.
I got them all saved in my phone.
And
got a whole sheet.
when you put all those together, they call it the glow peptide, when those three together. And then like you were talking about, Gunnar, because anytime that there's growth hormone around, right, it's always helpful. And you don't want to like, we're going to take, HGH as far as human growth hormone, like recombinant, those things. But when you take a peptide that's going to increase that to younger levels, you're not getting this super physiological amount. But it's going to, and that's always like a great thing.
So the growth, the one thing that used to come out with that was it doesn't discriminate between cells. So if it encounters a bad cell, a cancer cell, for example, everything's going to metastasize.
I don't necessarily. I don't think we've seen
that. Was always the warning label on that.
Well, there's many people that take these substances, then it just would be going nuts, right? But we haven't seen that, so I don't think that's necessarily
that
true.
was my fear.
But a great,
I've never done it. I always get asked, have you ever done anything? I'll be very honest with myself. I'm like, no, I've never done it, because always in the back of my head, I've had someone that got me somewhere that goes, it accelerates all cells, and I'm like, and so I've never done it. However, I was recently surprised because I did a function test and got my blood work back. I think I told you this, Jen, but my testosterone came in really low. Like I was 495 or something like that.
That's not really low for a man.
For me, for what I was expecting. For your test.
Yes, it is.
It was. No, but for what I was expecting, it was, because I think pre-COVID I got tested and I was like in the 800s, and I just assumed I was still there because I don't feel any different. But I got tested, and now I'm like, for the first time in my life, I'm like, I'm actually going to take this a little bit more seriously. I'm going to start looking into peptides a little bit more seriously and looking into that.
What was that test?
The function health test.
So when?
8 weeks ago, 9 weeks ago.
I'd be curious with your increased lifting in like one more month. Test it again and see how you naturally raise your test levels. You're the doctor here. And then talk about
heavyweights.
And your new focus on sleep.
Right.
Yeah.
Those two should bump those levels.
Yeah. Yeah, so I'll 100% try and do it naturally, but I've become less opposed to.
Well, that's a great question to end on with you, Ethan. So
Doctor.
I concur.
I encourage people to do it naturally first.
Yes.
Do what you can, get some information, and kind of earn the right to take the chute and ladder up on Candyland. And then from that perspective, when you get there, which I am, like I said, I wanted to accelerate the healing of my knee. I did site injections for 2 months. Do you want to speak to it all, like your support for, your approval of peptide use? Because I think some people are like, you're cheating, it's a shortcut. Like there's a bit of a shroud of judgment on there. But like for me, I just say, well, to me, protein powder helps. I take it. Vitamin D helps for me. I take it. Creatine. I take it.
Whatever he says, I'm going to circle back to one thing, is I have something that it's a good take home for people to run with.
Yeah, no.
Dated, but great.
Yeah,
sounds like you.
Ish.
Definitely should do things as natural as you can, right? Yeah. So like we talked about, like, you got to do the sleep, you got to eat well, you exercise, and see where you get with those things. But there's no doubt that there can be some very helpful tools to use. And so I'm not opposed to using those things. and especially if you're thinking about it right from the get-go, I'm going to do all these things. Even if you're like, I used to say this a lot, I'm not advocating for someone using steroids. I'm not advocating for that. But I would say this: if someone uses steroids, they still have to work out.
Yeah.
They still, it's like you can't get away. There's still the work that's put in. And so at the get-go, if you're going to do the work and do the things, that's where we start. And these are some really good adjuncts to use with that.
Mm-hmm. Yeah. To your point earlier, I know you guys have seen it, and if you haven't, worth a watch. I'm sure it holds up over time. The documentary Bigger, Faster, Stronger by Chris Bohr Bell.
Yep.
Mark Smelly Bell's brother.
Mm-hmm.
He brings a point, like, not to get too deep into the movie, but the thrust of it is, the take home for me is there are so many things that are approved, greenlit, not looked at as cheating. For example, caffeine, nicotine, eye black. He brought up eye black in the movie. And I was like, what are you talking about? And he goes, that is a proven performance enhancer. Mm-hmm. But then the things that are not approved, right? Those are no-nos. Whether they do worse or better things to the body for the short term, for the long term, again, TBD, to be discussed, right? Mm-hmm. You just look at it. And so he makes the case for all these people are doing it. Is it really cheating? Lasix, it improves your eyesight.
Right.
It's proven. As an athlete, you're allowed to do that, right? But you can't take testosterone. And then you get into things like in the league, it's hard to, in the NBA, for example, it's difficult to happen, but it has happened where someone can get a TUE, a temporary use exemption, to take testosterone. And you go, but why can he get that? Well, because his testosterone's naturally low and he had this, and so he needs it. Well, hang on. If you're giving the exemption, that's too subjective for me. Then shouldn't everybody be able to have it? It's, in my opinion, in those things, if you're going hard and fast on the rules, it has to be an everybody or nobody thing. Yeah. It can't, well, he doesn't have it. Well, if he doesn't have it, guess what? Then he can't play. Just like I can't play, right? Just like my dunking days are behind me, as we said. I can't take something that's illegal to get me to a certain level to allow me to play, but other people can take things with a TUE, or they can take things that could do more better that are not illegal, based on, I'm not going to say FDA, but based on whoever the judging body is. That's a tough one. There's a lot of gray area there, and I think Chris Bell does a marvelous job with that movie.
Documentary.
It's an excellent.
No, I haven't seen it. Watch it.
Watch it with
excellent documentary, and he makes a great point when he brings up the eye black, the Lasix, the caffeine, all performance enhancers, all legal. So I look at this and I go, at what point is somebody going to come down on? Because I had a lot of guys who, again, to your point about the preventative approach to it, every year, in fact, it would be happening right now, a week before training camp in the NBA, a ton of guys, 2 weeks before and a week before, would do preventative PRP or Regenerative in their knees, just so the season would go as smoothly as potentially possible.
Yeah.
And that still happens. I mean,
and you look at that and you go, that's a great thing, right?
Yep, great thing.
Great thing. But what about when somebody says, that's illegal now?
Yeah,
sorry, we're gonna consider that a banned substance.
Yeah, that's a tough one.
Or they can take it from their own body. We'll green light that, but anything like you said off the shelf, that's a no.
Yeah. No, I totally agree with you. And that preventative thing is really good. I mean, I had a patient probably 8 years ago who didn't have an issue, came in, and she said, "Hey, I want this in my knee because I just want to try to prevent that." I told her no at the time because I hadn't gotten that mindset yet. She came in now. I'd be like, yeah, we'll definitely do that.
Rowdy, come on down.
Yeah. They do it for all the racehorses, right? Every single racehorse that you see, Belmont, Kentucky Derby, all those guys have had PRP.
Wow, I didn't know that.
Yeah, but then the ones that do that and then they do something extra, and that's, flag on the play.
This is funny. I don't want to take us too far, but it's funny because I'm listening to you talk and I think I have visions of my father. Here I'm in like 4th or 5th grade, maybe 6th grade. And my dad, we have a vitamin cabinet. I can see my kitchen now as a kid, and he's got all of them down. And he takes it out, takes the garlic, takes the thing, and he would pull my sister and I aside, my brother, and give us each vitamin E and scoops of wheat germ into our yogurt. And that was him biohacking. He's like, I'm gonna be as preventative as I can. He's like, this one's for cognition, this one's for blood flow, this one, you know what I mean? Like my dad, and to this day, I mean, I was on the way here from the airport today when I was waiting for Luke, and I'm talking to my dad. He's like, "You're still taking your supplements?" You know?
So good.
So it's funny because I have a counter of supplements and I'm taking them all. But what's ironic is my dad, we should really look at some peptides for you for how you're feeling and your brain. He's like, yeah, I don't know about that stuff. Right. And because
the old school mentality is peptides equal steroids.
Yeah,
exactly. Yes. But also because it's an injection. And so now where I'm bringing us is, are you seeing now peptides that are oral versus injectable, and are they as effective? Because I really want to just like sneak some into my dad's like pill caddy.
Yeah, there's some that are oral, like BPC 157.
As effective?
Not as effective, but can be helpful, right? So
there's a nasal one as well, right?
There's some nasal ones that are out there, some that help with sleep and other things.
So funny.
But yeah, it's definitely that mentality is hard, and I understand it to some degree, but
yeah, I know. But I'm like, Norm, you're going to be 80. Let's use what we got.
Yeah. And I'll tell you a personal story of mine. I probably last year at some point in time, I did looking at telomere length, right?
Oh, cool.
That corresponds to age. And probably early on in my peptide journey, which was about 8 years ago, as far as when I learned to do those things and then started treating patients with those things. But there's one's called epitalon that is supposed to lengthen telomeres, or keep them lengthened. And so I probably did 2 rounds of that 8 years ago. Hadn't thought anything about it. I was working with another doctor looking at, it's called bioregulators, which are very much like peptides, but they're oral.
Okay.
And that's a whole new science and world and things out there. But he wanted to check my telomere, so I got the Spectra test, and it says that I have the telomere length of a 2-year-old. Two? Yeah, and he was like, I don't know if we need to do anything for you. And so I don't know if it was because I did that, however many years ago, that particular peptide, but that's what the tests.
Wow.
What's the name of that peptide?
Yeah, exactly.
Epitalon is what it's called.
But to your point, I don't want to drag on too much. How are you getting this research? How are you getting it funded? How are you getting to these things? Is it just like trial and error, or?
Well, the research is out there, and then as far as for me, it's like understanding that, learning that, treating patients, and seeing how those things work. I mean, 10 years in, when I treat someone's knee with stem cells, and they come back and like, hey, this is better. I'm like, really?
It's wild.
It's just, I'm amazed every single, it never ceases to amaze me now.
I think I know the answer to this, but I've never asked it. When you're working with teams, if you're a team doc, you don't get tested, right?
Tested as far as like?
For performance enhancing drugs.
Oh, as far as do I get tested?
Yeah.
No.
So when I was a strength coach in the NBA, the strength coaches got tested. And it was explained to me, and I was like, let's go.
Yeah.
Not yet, but one day. And it was explained to me, because I thought it was hilarious. Like, why are we getting tested?
Yeah.
They said, because you have such what was explained to me was, because you have such proximity to the athletes. You're dealing with them every day. You're an influence on them. And I'm like, okay, I'm sure maybe, but isn't everyone in the building? Like, if that's the case, isn't the person discussing their contract? Are we now going to test agents? Aren't the doctors who the team doctors are, they're not in the practice facility every day, but they're there as needed, and they're definitely at game days, and they travel on occasion. I'm sure that's different, team to team, but they tested us, and I thought it was funny, and I think that's that older school mindset of, if someone's going to recommend steroids, it's the meathead in the weight room. And I just think to me, if someone's going to recommend anything, it's you.
Yeah. And
it's you.
Yeah. And
So
and just for the record, peptides are not, they are against the rules. NFL, NBA.
They are PEDs.
Yes. Yeah. And so,
of course they are.
And so I do not treat any of my athletes with those things.
And I never, anytime anybody asks me, I'm like, outside my lane, dude.
Yeah.
These weights, this is my world.
Yeah. I just, my, with the things I do, as far as being team doctors, it's that regenerative piece. It's stem cells and those things that are legal.
Can you let people know where they can find you here in Nashville?
Yeah.
Because they can get treatment from you, go through what's going on. Can they get IV bags of stem cells from you? Because I'm going to be signing up when I come through again.
I'm going from here.
I was going to say.
So the website is drethankellum.com.
Okay.
Definitely start
How'd you come up with that?
It's very creative.
And you have an Instagram too, which I just started following.
Yep, drethankellum.com or whatever that is.
Yep. Actually, I'll look it up exactly.
And Facebook. But that website, there's you can definitely get in touch with me.
We'll put it all in the show notes. So if you guys have any interest in talking to Doc, that we can get you in touch with him very easily. Yeah. Any other closing remarks?
Watch Bigger, Faster, Stronger.
Yeah.
Watch that. That sounds like
this is like, honestly, this is the hottest topic in the world now.
And I'll tell you this, watch it with your kids. Watch it with your athletes. They'll find it super interesting.
Love
and it'll also bring back, because he makes references to, I think if it's been a minute, but like Hulk Hogan, R.I.P., Sylvester Stallone, I want to say maybe Jean-Claude was in there, a lot of
every great superstar. I mean, he even gets Arnold in there.
So that's in there, and then he talks about there being the heroes and common denominators, and then he goes into what are considered banned substances versus this, and it'll bring back some of what you probably grew up watching that they may have missed or because they started later. So good watch with the kids.
Bigger, stronger, faster.
Yeah, Chris Bell.
Okay.
Chris Borbell, he goes by Borbell.
It's great. Jock, thank you so much, mate.
Honestly, you're so awesome.
Thanks for having us. It was great to be with you guys today.
We'd like to have you back.
Yeah, that'd be great.
Tomorrow.
Yeah. Let's do it.
Thank you very much.
Thanks, mate.
Awesome.
Well, you'll be pleased to know that you have crossed the finish line of the episode.
What a champ. Now show us some love and subscribe to the show.
And tell your friends.
No, mates.
Okay, mates or enemies. We're not picky. This was the kids' table. You've been a great sport.